Okay. This one, here we go. Okay, so thank you everyone for joining us today. This is the Public Health Sector KCPA plan. So we're going to start off with just a few polling questions, just getting to know each other a little bit. So if you will pull out your smartphone and either scan this code or use the link in the chat I just dropped. So I'll give everyone just a few minutes, or probably a minute.
And while you guys are looking that up, I have some bad news, unfortunately. One of the members of our group is leaving Clay County Health Department. And so Chelsea won't be joining us anymore. But, she is going on to do really cool, interesting, fun stuff. And so we wish her the best, obviously. It's public health. It is what it is, right? We're underpaid and overworked, and people have to take care of themselves and move on to the next thing. So we totally understand, obviously, and wish her the best. And we'll keep moving forward on all this stuff.
Thanks for mentioning that, Joey. I forgot.
Teresa. Thanks, Teresa. I always get Platt and Clay confused because it's like, honestly, as somebody who like does most of their work in Midtown, north of the river, I'm terrible at that. Sorry. Thank you for the correction.
Okay, so first question, because this is the KCPA plan. What is your favorite activity that gets you moving?
And Teresa mentioned in the chat gardening.
Yeah, I was gonna put gardening. Yes.
Yeah. This is what's on the screen is obviously not mine. Okay, so
Which one? The triathlon?
yeah, well, there's like 3 of them, and
Yeah, surfing, paddleboarding. Those all sound like you.
Paddleboarding's fun. Who's the paddleboarder in the group? Oh yeah,
awesome.
Sandy? That's awesome.
Yeah, that is awesome. I thought that would have been Lightner. Joey, you've paddleboarded before, right?
I do paddleboard. Yeah, it's on the ocean. It's a little bit more.
Just don't start out in the Atlantic.
Right, touche.
Not
River fishing, Teresa. That's fun. Teresa, do you fly fish? Sandy, where do you paddleboard at?
Oh, well, any lake.
Yeah.
Because we're kind of stuck in the middle of the country, but the Caribbean's not bad. I have done that once.
Yeah.
But the Atlantic is not good.
Touche. I mean, it's more like surfing, right? Like paddle surfing, and then like chill, relax, paddleboarding. Sandy, when I was in college, when I was writing my dissertation, every day after work, I would go to Pot 2, like Pottawatomie County Lake 2, which is like a spring-fed, beautiful lake, and I would take my dog and we would go paddleboarding for like 2 hours just to like decompress. Yeah.
My sister has a French bulldog that she's got him a life vest, and he has learned to sit on the front of the paddleboard.
Oh, that's cute.
Yeah, Waddy does the same thing, except Watt's white. He's around here somewhere, but he's a like 80-pound white German Shepherd.
Oh,
so, yeah, he's a big dog, and so he rides on the back because if the weight distribution just doesn't work out, he's on the front. So, but yeah.
So Teresa, by the way, the type of fishing she does is hillbilly fishing, and then Ruth does dancing. So I'm gonna go ahead and move on to the next. Oh, go ahead.
Sorry. I'm having too much fun. Ruth, what kind of dancing? And feel free to like if you're able, I know Teresa is always like doing fun stuff and having a good time, but if you guys want to turn on your videos or like unmute on mic, feel free to.
By the way, Joey, I put this question in for you specifically because you're always traveling.
Yeah, yeah. Is it on the Mentimeter? I actually stopped it, Katie. I'm sorry.
Oh, that's okay. Yeah, it says if you could
Can I
go
just click?
anywhere in the world, where would you go and why?
I can just click on the link again, right?
Yep.
Yeah.
So for whoever just joined us, we are almost finished up with our Mentimeter, but we're just doing some fun questions and getting to know each other a little bit for some of our new attendees. I feel like this one's a harder question. I actually don't know.
I had to think about it too.
Yeah.
South Africa or Africa? Wait. Okay. Africa, such different. Oh, touche. That's a good point. And North Africa is like not doing well. I don't know. Then last week, Morocco had the big earthquake. Libya has these major floods. Something like 70% of the population's underwater right now. It's crazy. Everywhere
Teresa would
because
go.
go ahead.
Oh, Teresa would go to the Colorado or Colorado. Oh, wow, I can't talk this morning. Colorado mountains.
I like the answer everywhere. That sounds just about right.
Thanks. That was mine. It's like, I don't know. I'm having a hard time deciding and I want to go see the world. Well, these are fun. Australia, I don't know who put that, but that sounds terrifying. All the different bugs and critters. It's good luck.
I don't
Fun
think the
one.
bugs everywhere though, right? Like Australia is a big country.
But they've got like giant insects that look
Yeah.
terrifying.
I
The
mean,
spiders.
yeah. I think it's so funny because here there's no we don't have any like poisonous plants or insects. And so like going to the Midwest where there's like, brown recluse that live in every single house in the Midwest, and can cause like a hole in your body. It's crazy.
That's for sure. Well, thank you everyone for participating. I hope that was fun. I think that was one of our first Mentimeters. But just to go over the agenda for today so everyone kind of knows what we're going to be doing. We did our Mentimeter questions. We'll go ahead and we'll do a round of introductions just for those that don't know each other. And then everyone who has attended previously has been working to put together the public health sector for the KCPA plan. So what we're doing today is we're going to review that, all of our efforts on rating our strategies and tactics. And I know I sent out an email to those who have attended regularly in the past. And what I'll do for this time is I will pull it up and we'll go through it. So if you had a chance to look at that overview section and you know what you want to say, we'll do it then. And then this has been mentioned before too, but we have funding through the KCPA plan. So we'll talk about that today because we can officially start applying for funds. And then just some other updates, group updates, and then when our next meeting is. So on that note, I'm going to stop sharing my screen and we'll start with introductions. Joey, do you want to go first?
Sure. Joey Leitner, happy to be here. I'm an assistant professor over at UMKC, and I study mostly physical activity. I used to work at KCMO Public Health, and then I do some research associated with public health too, specifically around like structural public health, CHIPS, CHAWS, accreditation, like those kind of things. And so I'm a site visitor for FAB and a whole bunch of other stuff. Katie, did you get to introduce yourself?
No, I didn't. So hi, I'm Katie Amy, and I work for the Kansas City Healthy Lifestyles Collaborative, which sits inside Children's Mercy. And I work on the Kansas City Physical Activity Plan and I do sector support. So I support the public health sector. And I will go ahead and pass it on to Sandra.
Sandy might have stepped away for a minute.
Yeah, I mean, her camera did turn off. That was probably a bad
Yeah.
choice. Teresa, do you want to introduce?
Teresa, I don't think we can hear you.
Teresa, yeah, I don't think your mic is working. If you want to just type in the chat, I can go ahead and read it out loud. In the meantime, DC, do you want to go ahead and introduce yourself?
Sure. My video is not working for some reason. Hey guys, I'm DC Oconta. I'm a disease investigator from the Johnson County Department of Health and Environment.
Thanks for being here, DC. Ruth, do you want to introduce yourself?
Hello, my name is Ruth How are you? My name is Ruth Matsikwa. I'm an environmental health practitioner. I teach environmental science in public health. So I'm interested in doing public health and environmental sustainability, and also determining environmental degradation or environmental effects which might affect public health. Thank you.
Well, thanks for joining us today. And
Thank
I'm
you.
going to go ahead. Yeah, I'm going to read Teresa's really quick. So Teresa is an RN and health educator at the Clay County Public Health Department. They do the marketing of clinical services and a lot of the community work and maternal child health. So Martha, would you like to introduce yourself?
Sure. Good afternoon. I'm Martha Smith, and I'm the State Maternal Child Health Director with the Department of Health and Senior Services.
Awesome. Thanks for being here today. Bonnie?
Hello, my sister.
Bonnie, are you there? Okay, that's okay. We'll come back to Bonnie. Simone?
Oh, I'm Simone Taylor. I am the Regional Women's Health Analyst in the HHS Office of Secretary for Health. I'm a nurse by profession, and I used to, before this, I worked at the health department, managing some of our public health programs back in the day when Joey and I used to work together. I will also just put out the caveat that I will be having a baby next week, and so I'll be gone for a little while. So I will see you all again after this meeting in 2024.
Congratulations.
Well, congratulations.
Sorry,
Thank
Katie, I
you.
had to jump in.
No, I was saying congrats too, worked out. Okay, so I think we have one more. Alara?
Hi, my name's Alora, and I am a student at Austin Peay State University, and I am joining this Zoom to be able to learn more about the public health.
Thanks for being here today. I think that was everyone. Did I miss anybody? Okay. Well, on that note, we're going to jump over into reviewing the public health sector of the KCPA plan. So all the work we've been doing. So we'll go through the overview. We'll look at the strategies and tactics. Joey, do you think it would be easier for me just to share my screen of the document? I'm going to also drop it in the chat while I'm remembering to do this, so everyone can have it as well.
Yeah, so guys, this will be the final document that goes into the Kansas City Physical Activity Plan. So feel free to like read it with the detail eye. I think if you have any like grammar, punctuation kind of comments, you can send those to Katie after. I don't think we need to worry about those so much. But really kind of the overarching structure of this little bit, every sector, the 10 sectors, right, Katie?
Correct.
Every sector has one of these and is really like the kind of the guiding document for their sector. We've been through all the strategies, we've been through all the tactics, you know, we've looked at all of that stuff. So we should be good on that. But you know, general comments, you know, things that should absolutely be included, things that maybe are missing, any of that kind of stuff. We want to, you know, just run it by you guys today and make sure it's good. We kind of put the final blessing on it. Again, if anything's minute needs to change, I think you can send those comments to Katie after. But yeah. Do you want to review this, Katie?
Yeah, what do you mean? Do you want me to like read it out loud? Or do you want to?
No. So I mean, I could review it too if you just want to scroll through. So guys,
Yeah.
we modeled this on the National Physical Activity Plan and used some of the same boilerplate language, but you know, essentially public health, we define public health in this document. We talk about, you know, why we're here, why we're focused on physical activity, things that tie into the strategies and tactics, right? So we're looking at all of these different things associated with, you know, public health and its role in physical activity, you know, changing physical activity and physical activity promotion. And then we get into the strategies and tactics that we have identified for this, you know, sector.
And so, yeah, and then so like Joey said, and these strategies, I'd like to pop in and mention that they're in order based off how we rank them in our discussions. So, and some of the language did change based off of, again, our discussions on whether or not they were relevant to KC, or tailoring some of the language to make it more relevant to the Kansas City region. And so pretty much what we're looking for is, does this make sense to you? And also feel free to comment. These are our strategy cards. And if you don't feel like the picture is relevant, also feel free to chime in on that. Here's the tactics. So these are essentially the steps we will be taking in order to achieve our strategies. And I'm just going to go through it slowly.
And while you do that, Katie, essentially what Katie has done is taken all of the work that we've done over the last 6 months, put it into one cohesive, you know, document that will be put into the big, you know, overarching plan. There's none of this should be new. It should all be, you know, changed to be Kansas City specific. Where'd you find these pictures, Katie? On Unsplash?
No, Canva, because
yeah,
we can, yeah. And that's where I created this, so.
Cool. So I think everyone who kind of generally comes to these meetings, I'm guessing DC, Simone, Sandy, Teresa, you know, you guys should have received this already. If you haven't, we can, you know, if we can decide today, I guess this is kind of the next thing. How do we want to move forward with this? Do we want to, have you guys had enough time to review it and want to give it the blessing? Do we want to wait a month so you have time to review it? Do you just want to send Katie the, yes, this looks good, here's where you missed a period or a comma? Or, I mean, because Katie knows that I am terrible. I write too fast and then I forget I forget whole words, let alone like periods and commas. So,
Yeah.
and you know, we all make mistakes. That's totally fine. It's no big deal, right? How do we want to move forward?
I should also state, so my team has also already reviewed this. So hopefully between, 5 people who've reviewed it so far, the punctuation and grammar is right.
I gotta be honest, I haven't had a chance to review it yet.
Yeah.
If I could review it in the next week and send Katie an email saying that, or giving it the thumbs up, that'd be cool.
Yeah, that would be great. Thank you, DC.
Does that work for you too, Sandy?
Yep. That works
Cool.
for me.
Awesome. So let's set a deadline. How about next Friday? Have everything to Katie by next Friday so that she can give it the final blessing and like we can move forward.
Perfect. Well, I'm excited. Okay.
Yeah, guys, that's a big hurdle out of the way. So I do just want to commend everybody. I know that like it's taken some time and energy to like kind of go through stuff and decide kind of what makes sense, what doesn't make sense. How do we do things in Kansas City, right? And what is the role of public health in KC? So thank you for all of your like effort and time. I know it's been a little slow, a little boring, but I think we're now, Katie, the next thing on the agenda is money, right?
Mm-hmm.
So I think now we're interested in moving all of this forward, right? So we have this long list of strategies and tactics, and what we want to do is impact it, right? So, Katie, do you want to go through this?
Yes. So what this is that the KCPA plan has funding available to each of our sector groups up to $15,000. And so the point, this kind of ties into the strategies and tactics we've been working on, because we're looking for applications, proposed projects that align with our sector strategies and tactics. So scoring is based on these areas. So mostly whether or not it is more than one system level. So while individual behavior is great, we want a larger impact. So you get more points if you've got more going on for you. And then if it's cross-sectoral, so Joey mentioned this, we have 10 sectors total. So like, how can we work with our healthcare sector? How can we work with Parks and Rec? You get more points for that if we can make it cross-sectoral. And then, oh, I think I skipped over this one, or maybe I didn't. You get points if it aligns with our strategies and tactics. The other stuff is just background information. So like the project itself, obviously, and then your next steps, and then the amount you are requesting. So I also posted this in the chat, so you should have it. So you can fill it out if you have a project idea or just to follow along. But the scoring is at the bottom. But the point of this, it's supposed to be short and sweet. We don't want to make it complicated for anybody, but we also want to work on achieving the goals of the KCPA plan. Sound about right, Joey? So if anybody has any ideas now that we've reviewed now that we've finalized the tactics and strategies, and you should have the document in the chat. And again, if you didn't receive it, like Joey said, let me know and I can send it to you. But we can start working on project ideas. And this doesn't have to be as a group. This can be individually. In order to submit it though, it has to go to Joey. So if you're applying for anything, you need to send it to Joey, and I'll put his, unless you want to, your email in the chat, Joey. And then,
Sure.
Cool. What we do is that every meeting, if we have an application, we review it as a group and decide if it passes. And if it does, it needs to go to the core work group next. So the core work group of the KCPA plan is made up of all of our co-leads of our sectors, and they'll review it and give the final yes. And then, yeah, it's that easy.
Yeah, it's not super hard, guys. So like if somebody has an idea, and it could be one of us, it could be somebody external to this group, They just need to like, this is a one pager, right? Just like write up what you want to do, how much money you're requesting. It comes here and then it goes to the bigger group, just to, checks and balances, and then they get the money to do whatever. And so I have a proposal that I'd like to run by the group, if that's okay. I think we should, after Friday, after Katie gets done with the strategies and tactics, we should send that along with this document to all of you guys, obviously, and to anybody else here or anybody else in public health that has the interest, ability, kind of stuff that has done this in the past, health departments, i.e., to apply for money if they want to. What do you think? Yeah. Yeah. I'm curious if anybody has an idea and wants to talk through anything. I have a couple, but like, I always have ideas. It's a problem. Simone? No? Okay.
Yeah, I was going to say we can also, so it's up to our sector on how we want to approach this. We could work on this application individually. What Joey said, send it out to health departments, or if we want to come up with an idea as a group and apply as a group, we can also do that.
I'm giving
Go
ahead.
Sorry. I can also tell you some of the other sectors, what they've done. So like we just changed the name, Media and Communications sector. So they did a messaging campaign. So we worked with a marketing company called Overflow. And so we're finalizing all of that now. So they applied for funds to do that. And then our healthcare sector brought Dr. Trilk over. She's from South Carolina and she teaches lifestyle medicine. They brought her over to do grand rounds at Children's Mercy. And then she also presented at some of the other institutions nearby. So KU Med, UMKC, and KCU to talk about lifestyle medicine and how to incorporate it into school curriculum. And then they also expanded what is known as Just Walk. So it's part of Walk with a Doc, and that involves having healthcare providers go into the community and walk with community members and discuss a healthcare topic. And then schools group. I'm trying to go through all these. These are just some examples. They did a professional development day for PE teachers in USD 500. They taught a Ply yoga training. And then I think that might be it. I might be missing one of our projects, but just some ideas of what some of the other sectors have done. And I know that our sports sector, well, it's not funding. They originally did apply for funding for this, but got it funded another way. They're working with Aspen Institutes to do a mini state of play report. So
I think one of the things that we talked about too was in our strategies and all that was like getting folks involved who are already doing physical activity stuff out in community. So I think in thinking about who we'd want to send it out to, I think health departments are fine and great, but we know that they could easily write up something and, get all the money if they really wanted to. And so thinking about, are there some partners that we already have that are doing some of this stuff that could support the work that they're doing or expand it? I know that there's one that comes to mind, but we're Kansas City Mo, right?
Yeah, the Kansas City region, not
okay.
Yeah,
so they're
like
actually in Wyandotte. Okay,
County.
perfect.
Yep.
So I
Wyandotte
think that maybe we could think about some folks in community that we might have a relationship with to share this with, and think about if we want to prioritize some of that work that's happening already in community. I would think that would be maybe a better route, starting with the health departments.
Simone, I completely agree. And what I have found in the past is that I think you're right. We should send it to community groups who could do this stuff. And like, in addition to like Nikki and Yoga on the Vine, Nikki Fit and Yoga on the Vine and those kind of folks, also like maybe Maddie Rhodes or, somebody like that. But I've also found that like, they don't have the interest or time really to like go to meeting, it's like,
I think we could also maybe work with them. You know what I mean? Like in my capacity at where I am, I would be
Yeah.
happy to help them do it. So if there are
Agreed.
folks that are interested, I think I can, like, and I'm not volunteering anyone else. I also will be gone. So who am I volunteering? But anyway, I do think that if there are folks, I don't know if this will happen so quickly. There are definitely
Yep.
folks that I'd be happy to help pull this together because they're already doing good work. So just a thought.
I completely agree. And my point, Simone, was that like I'm happy to like write in anybody if some folks are willing to like deliver
Yeah.
physical activity programming to health department staff, right? Who we all know needs it, could be really important.
Oh no, it looks like we lost her.
I know. Sorry, Simone. I don't know if there's anything in Johnson County that you guys think we should prioritize and I think that we can get this done in a couple months and get funding and like start rolling if we want to. So just an FYI.
I can't think of anything specifically in Johnson County. I mean, sure, we could start a program at the health department, but when you think about, access to like gyms and fitness centers and parks and safe neighborhoods, things like that, Johnson County is probably one of the better places in the county to worry about that. Not saying that it's not needed, because obviously we do have some areas that could use a lot of that support. But I don't know. I'm not aware of any at least community-based organizations that are focused on physical activity here in the county, which could be my fault. Like, I need to pay more attention to what's going on, but like, I don't know about it.
I don't either. I mean, not that I can think of. I mean, we've been focused on healthy eating and community health. But as far as physical activity, I'm not sure. I mean, we as county employees, we get incentives for being healthy and being active, and they actually give us money to use towards like a gym membership or a class that you can take. So it's a really lovely benefit that we have. So I mean, we're blessed. We're blessed here. I mean,
Yep.
the pay may not be great, but the benefits are awesome.
There is one group that I actually just thought of. Well, two things. So our partner in this might be the schools on this side, just because they have more contact with kids, and I don't know what their physical activity plans are in the schools, whether or not their programs are being pulled or what, I don't know. But there is one organization called the Spot through Olathe Public or Olathe School District, and they focus a lot on kids of color who don't have access to some of those resources. Like, it's like an after school spot. No pun intended. But they do a lot of things after school, like play basketball. They might do some things outside, things like that. That might be a good group that we could focus on and send the application to, or something like that.
Yeah, DC, will you put that in the chat so that Katie, or maybe find the link and so Katie can make sure to send it to those folks?
We still have I had 3 kids. I have 2 kids now in school in the Olathe School District. They still have ability to have like PE classes and things like that. So that's a good thing too.
The Johnson County CHIP has always been focused on physical activity for like 20 years, right? Has been focused on like physical activity, obesity, healthy behaviors associated with physical activity, obesity. Like it's been called multiple different things in the last 20 years, but it's always that kind of that like realm of stuff. Is there anything in there that we can like there's the physical activity plan stuff and there's Johnson County CHIP. And so there's some stuff in there that can be done together.
I can look into that. I'm not involved with any of the community health improvement plan structure.
And
But I can ask because we're part of community health, so.
Oh, cool. I was just thinking, because I mean, stuff like that, where it's like, you know, you have a strategic plan for community health, and then like there's this physical activity plan. It seems like a natural thing that should work together, but who knows, you know?
Yeah, I can check in on that.
Cool. So Katie, probably check the other chips in the metro. So I know the KCMO chip, because I just finished it, doesn't have anything associated with physical activity, but the other chips might.
Okay. Really quick, some other groups that are over in Johnson County and maybe not solely focused on physical activity, but so Jill Rayford, she I know has done a lot community like organizing for walk and bike to school days. So I know last year she partnered with, I was going to say Lowrider, it's a bike club. So they might be somebody to also reach out to, because that's still a way, obviously, of increasing physical activity. And they work and teach bike lessons to kids and how to work on bikes. But yeah, just throwing that one out there.
So the guy who heads that program with the lowrider bikes is also the guy who heads the spot too.
Oh,
And,
awesome. I was like, I
yeah,
know that
well,
name sounds so familiar. So
Yeah,
awesome. Thank you. And I just got the email. Appreciate it.
perfect. No problem.
Sorry, my computer died. But there's a group, there's an organization called the NEA Project. And they've been putting on, I think, trying to put on monthly events geared at Black women around physical fitness, but there's also a few other kind of components they have. So they might be interested in one of the and I'll just throw this out here. One of the things that we were kind of looking at earlier in the year was like opportunities to maybe form some kind of physical activity, something for kind of like adolescent girls, because there's kind of there's a gap there. But finding a partner was kind of difficult, or figuring out whom. But with some, and that might be more schools too, I don't know, because we were thinking like how could we integrate it, but I don't know if anyone has any ideas around that. But
well, Win for KC, oh my goodness, I had it in my head and I forgot the names of their programs. I know that they've got like a reading program where they also incorporate physical activity into it, and then I got to think of the other one.
They have like a mentoring program with
Yeah.
like college students, where college girls go in and mentor, high school or middle school girls. That middle school time frame for girls is really, really, really important, right? So that's the time frame that we got to hit. And like, our HHS funded YES project focused on adolescent girls in KCPS. And it's tough. I mean, that's the easy answer, right? It takes a lot of money to impact. I don't know if there's a way to leverage these dollars to, get more federal dollars and do something that's like very, middle school girl specific on the east side. I think that would be really cool. And like, on our YES project, we recruited both boys and girls. We tried to over recruit girls, so all of our recruitment material was like all girls, right? And we got about half boys and girls, which is much better than most interventions on physical activity, right? Because the majority of the time it's about 70-75% boys. So better, not great, but. Katie, you want to talk about Girls on the Run?
Yeah, so I don't know if you've heard of Girls on the Run. We partner with them in the Kansas City our Children's Mercy Community Garden, and we do a community impact project, but they also do their training over at Hospital Hill on the track. But they do target 3rd through 5th grade girls, and then 6th through 8th grade. They also have camps, and so but I don't know if they only specifically serve Missouri or if they also go into Kansas. But I do know that they solely focus on girls.
I think they also do go into Kansas.
They do? Okay, good.
It's like a national program. They're everywhere, right? Which is great. So I want to be mindful of time. We only have, 15 or so minutes left. I think that's a good plan, right? Let's, for the next week, let's, finalize our strategies and tactics document. Make sure that's good to go. Katie, I think on Friday, if you and I want to chat, next Friday, you and I want to chat about like who we should send stuff to and move that forward. If anybody has any ideas, Simone, any community groups or anything like that, I think send it to Katie or me and we'll get those folks included. We'll copy you guys on that email so you have the documents and like what we sent to. Katie, you were going to say something.
Yeah, so I'm out of town on Friday. We can still chat. It's just gonna have to be a phone call because I won't be bringing my computer with me.
We could do it Monday too. I mean, like after that, after the deadline of like when we all get it all done. That's before the next meeting so that we have time.
Oh yeah, absolutely. We've got
Yeah.
plenty of time before the next meeting. Okay.
Yeah.
All right, awesome.
Go ahead.
Oh, I was just gonna say, just a few things I wanted to mention before we did end this meeting, but were you done, Joey? Okay. So I just had a couple of group updates. So the Kansas City Healthy Lifestyles Collaborative, we host quarterly meetings. So we have one coming up. It is Thursday, September 28th at the Kauffman Foundation Conference Center. It is free. You just need to register and we'll be providing breakfast. I'm putting the link in the chat now if anyone is interested. So we have a panel of guest speakers. We have 4 of them, and they are experts from local organizations that are working to improve food access. I know we've got somebody from Canby's, Cultivate KC, Kansas City Community Gardens, and then After the Harvest. So should be an interesting and very full meeting. And then I know I mentioned this previously that our media and communications team was working on that marketing campaign. So we just wanted to let everybody know that we'll be sending that out at some point. We have a partner toolkit to use this messaging framework. And then also we are looking, if you have any event coming up, for photos of people being physically active. Feel free if you want to share those with me, that would be great. I know that we'll be targeting the Walk to School Day. We'll be getting photos from that. So that's all the updates I have. So part of this group, if anybody has never attended another sector meeting, we do give partner updates. So if you have anything you wanted to share, I do a monthly newsletter for each of our sectors. And so I can share that information with other members who may not be able to attend meetings. Yeah, so feel free to let me know what's going on with you guys.
Like Simone, if there's any like funding stuff from HHS that should go in there, or like new things, so maybe like highlights of African American girls and their like need for physical activity, or something like that. If there's any like from anything from MMWR, anything like that should go in there. Katie is always good at like finding stuff, but also like if there's anything specific that we think should go in there, we can suggest it. Well, thank you guys. I guess we will see you in a month, right, Katie? When's the next meeting?
Yep, Thursday, October 19th. So this one got a little mixed up because it should have been next week, but I was unavailable. So thank you for attending a week early. But our next one should align back to our regular schedule. So it's October 19th. And then I'm posting the link in the chat to register.
Katie, I'm going to be out of town. And like,
ignore that.
I know.
Okay.
Is it okay? Can we meet on the 12th, or can we meet on the 2nd of November? One of the two.
The 12th of October, or the 2nd of November. Did I hear that right?
Either one, yeah. Does anybody have a So this is, I think we can like do the 2nd of November if everybody's okay with that, because if we, if it's gonna take 10 days, 2 weeks to like finalize the document and then send it out, and then people are gonna have to respond to it, and then, we're gonna have to like do that kind of stuff. People are, we won't, I don't think, have much to talk about if we meet on the 12th. But if we meet on the 2nd, that's an additional 2 weeks.
Yeah, and it gives time also to send this application out to some of the community partners that were mentioned today, and time for them to fill out the application. So I'm cool with the 2nd if everyone else is.
I'm
I will
cool with it.
update. Perfect. I will update that registration.
Thank you guys so much. Sorry, I'm doing another race. It's my last one for the year, and I'm so excited. You have no idea. I'm so tired. So yeah. Anyways,
Is this the Kansas City Marathon?
no, it's a half Ironman in Portugal. So
Okay.
yeah, it's gonna be up the hills, and but Portugal has these massive hills that come off the Atlantic, and it's like up and down those hills, which is gonna be. I've been doing hills, and it's gonna be terrible, but my last one until spring, so that's nice.
Good luck.
Yeah, good luck.
Thanks. All right, guys. Have a happy Thursday. We'll see you in 6 weeks. Simone, congratulations. Send me a
Thank you.
picture. Send me a picture after.
Okay, I will see you all next year, but yeah, I'll send it.
Okay. Be safe, guys.
Sounds good. Bye.
Bye.